Solution-focused therapy can be defined as an intervention that focuses on helping clients to identify and build upon their strengths to work towards finding solutions to the presenting problem. Major concepts of solution-focused therapy include language, de-emphasizing problem talk, and solution talk. One distinguishing feature of solution-focused therapy is that the interviewer adopts client language. As social workers, we have to listen to our clients and make the best decisions about how we will respond and how best to respond. The things we do and say, both as social workers and in general, is very powerful to shaping one's sense of reality. De-emphasizing problem talk means to do away with negative acts and old ways of thinking, shifting the focus away from the client's difficulties. Aims of solution talk are to create a context for change where hope, confidence, and positive expectancies for change increase, and the client can co-construct with the therapist about workable solutions to his or her problems or challenges. The ultimate goal of solution focused therapy is to establish an open and collaborative working relationship with clients. Solution talk is the best way to achieve this. Shifting the focus away from the client's difficulties and focusing instead on their strengths and being positive will encourage them to act and or think differently than they normally do. The goals of intervention for solution-focused therapy include the client focusing on solutions to their problem, discover exceptions to their problem, become more aware of their strengths and resources, and learn to act and think differently. The intervention process begins with engaging the client in order to develop a trusting relationship and informing the client as a social worker that I am here to help them with their desired solutions. First, begin the conversation by asking questions that will identify the problem, such as, can you tell me more about what brought you in the office today? Then inquire about what was the final straw that made the client decide to seek help today. This technique is referred to as effective questioning. The next step could be to ask a question that externalizes the client's problems. For example, if a client is experiencing anxiety issues, inquire about what anxiety is to them and how it makes them feel. Next, if possible, use reframing comments by reflecting on what has been said and then give the clients credit for having the courage and strength to seek help on his or her issue. Moving forward, ask the client about how they have been managing the issue thus far. This type of questioning is strengths reinforcing coping. This question will elicit a response to find out if the client has a support system and or great coping skills. Here will be a great time to ask an exception question, which could be something like, what was different in the past when the problem wasn't a problem? This question works towards making solutions and helping to identify strengths. Then afterwards, ask the client the miracle question. The miracle question is, ask the client if they went to sleep and say overnight the problem went away, and upon waking up, what would they realize was different about that day, and what would be some of the things that they would do. Okay, and to answer the miracle question, the client could say, well, my problem would be different. I wouldn't have these anxiety attacks. I would be able to function, great within society and things of that nature, and then moving forward, the miracle question, it helps to provide clients with a way to describe, concrete goals, which helps to create a more hopeful and positive spirit and mindset for clients. Afterwards, this will be a good time to ask a scaling question. This will help, us to see, how motivated the client is on a scale of 1 to 10, with 1 being no and 10 being yes. You can ask the client, how motivated are you to achieve this miracle question? The question will help provide the therapist with insight on the client's motivation to resolve the problem. Then if, the client situation is applicable, suggest the following tasks that will encourage them to act and think differently. The two tasks are, formula first session task and surprise task. Formula first session task asks the client to reflect on things that are happening in their life that they would like to see continue. This could be something such as, I get to see my kids, once on the weekend, or they spend a weekend with me, and that provides me great joy, and it helps to take my mind off the problem, and I no longer have anxiety attacks. They help me relax. They can write that down, or, going out to eat with my friends helps me to relax and provides me some downtime. So, the client could talk about those things, saying that, this helps them to, relax and calm down, and, gives them a relief from what's going on in their life. And they will write those things down, and they can bring it to the next session. The second task, would is the surprise task. It helps, the client to do something surprisingly for someone who is close to them, or maybe not even close to them, maybe someone they don't know, a complete stranger. Just something to help them feel more positive about themselves. Now, as therapists, we are not supposed to tell them, what the surprise task could be or what they should do. Of course, it's a surprise. So it's intended to make them feel better as a person. And the surprise task, for example, could be if I was having conflicts with my mom, something nice I can do for her would be maybe take her out to eat, because she's a very simple woman. She doesn't ask for much. So, that would be a nice surprise for her, because it would be unexpected. She wouldn't have to pay. It would be all on me. And maybe, then throughout, that would ease the tension between us. And throughout dinner, we can maybe, discuss the problem, or it would help lead to, us having a better relationship or something of that nature. Okay, so next in the intervention process will be kind of sort of, well, from there, you will, tell the client, we'll talk about these things at the next session. To kind of close the intervention, when it reaches the time to close the intervention, you can ask your client questions such as, what will you do to make sure you don't need to come back and see me? Or, if I was to see you 6 months from now, what will you be able to tell me about the changes you have made, and, you as a person in general? And so for example, for a client who were experiencing, these type of issues, and they went to therapy, and then I meet the therapist, I run into them 6 months later or a year on the street. I could say, well, tell me what's going on in your life. What has happened since the last time I see you? And they could say, well, I don't have anxiety issues. I went from getting my kids to, every other weekend to like 3 to 4 times a week. My relationship with their mom has gotten better. We have learned to effectively co-parent. The problem that I had is no longer in the way. I found a way to, manage the stress, just things of that nature. We would hope that from solution-focused therapy that they are doing better. That's the goal, to facilitate a positive change within our clients. So, moving on, as I was saying, hopefully this helps to create a positive change in our clients, in which they have built upon strengths that we have, set forward, or that we have recognized in the therapy session. Build upon those strengths so that they have enhanced their overall well-being. And hopefully that affects people close to them, so he or she is in a positive environment, and that behavior is reinforced. So in the next video, I will attempt to demonstrate a role play of solution-focused therapy, and hopefully I do it correct.